This is our 600th video on YouTube, so I want to talk a little about a subject that I think a lot of people have asked me about, and I go through a similar description all the time, so I thought it would be good for at least for you to understand this before you come in, even for consultation, which is dark circles under the eyes. Everyone asks me, what is this? What can you do? Can you operate on this? Can you put a laser on it? You know, what can you do to help this? And so first we have to do is figure out what it is. What is the diagnosis? And that's obviously difficult to do on a YouTube video, but hopefully it'll give you some ideas on thinking about this. So this is more a video about pointing to different diagnoses rather than trying to give you a definitive one. Obviously I can't do that on a video. So what is it? Well, first of all, we have to define what is the depth of the problem. Is it on the skin? Is it under the skin? Or is it even deeper? So I think the easiest way to partition the diagnosis is to start from the top and move down. If it's on the skin, sometimes there's this brown discoloration on the skin, and that can be usually caused by an allergic reaction or a general allergic type of entity called atopy. So if you have allergies, they're also known as allergic shiners. It can be due to vascular engorgement or blood vessel engorgement. Sometimes it's just due to the fact that you keep on rubbing your itchy under eyes and you create this streak of hyperpigmentation or darkness. So how do you define that? Well, the way you look at it, if it looks like a brown streak, almost like in a linear circle that extends across the eye, that can be an indication of this hypermelanosis or this darker skin color around the eye itself. The way to determine that is you can take your fingers and stretch it out. If the actual area stretches out and thins out and stays that brownish color, that's usually indication there could be some atopy or allergy. And it's best to consult an allergist or someone that specializes in the head and neck region that could help you with that before you come to see me for consultation if that's the direction it goes. The way to treat that beyond treating the allergy itself is also treating the effect. So obviously the best thing to do is treat the cause, which is possible allergy. The way to treat the effect would obviously be to try to lighten it. And my feeling about using lasers near the eye, I don't particularly care for it. I do use plasma, which I find very safe, but any lasers that use a type of what's called photothermolysis technique, in other words, the laser is absorbed by color, and the retina has a huge amount of melanin in it. So I always want to be safe using lasers near the eye. Obviously, if your doctor uses, very appropriate eye shields that go onto the eye itself, then that can be very safe. But just remember, be very, very safe using lasers really near the eye. So in general, I use a bleaching product like hydroquinone, or you can use kojic acid or various other treatments. These are in general at the 4% dosing, has to be at a physician level prescription. But that's something that can help for these pigmentation areas. But again, try to treat the cause, not just the effect. The next depth is coloration due to hypervascularity. In other words, in layman's terms, just more blood vessels or very, very thin translucent skin that has a apparent muscle and also some degree of engorgement of the veins. This oftentimes, generally speaking, doesn't streak across the entire eye. It usually sits near the inner part of the eye. It's more of a condition near the medial or inside the eye toward the nose than outside, but it could go on the outside. That condition also can fluctuate with women that have menses or menstruation. During times of menstruation, it can be more engorged. And that is a condition that is very hard to treat. I know some people, I do a lot of fat transfers. I know some people like to put fat in there, and I think it's just a little bit dangerous to try to get it that close to the skin. I've noticed with my fat graft that sometimes there's a local change to the architecture where there's an improvement, but it's not consistent enough for me to tell you that I would offer that to you as some kind of guarantee or reliable outcome. So that's another type of reason to have that, and it's very hard to manage that condition, very, very hard to manage that condition. And then also the other thing, which is the surgical reasons, is just hollowness or an eye bag. And sometimes we look too much at the bag and we don't see what I call negative space, which is the area around it. So you probably remember the idea of the shoreline, which is in youth, and young people also have eye bags and hollowness too, so I don't want to discount that. But in more of a youthful state, oftentimes we have a high tide, meaning that there's a lot of volume and fat around here. But the eye bag itself is very unique because the fat there oftentimes doesn't go away despite fluctuations in weight and changes. So the surrounding shoreline shoreline dissolves, and then you have these rocks that show up. It's a doctor that I don't want to take credit for that. It's a doctor that I heard give that lecture about that, and I thought it was a really interesting idea. So we oftentimes try to take those rocks out when the real problem is just hollowness around it, that we need to refill the shoreline up high to cover the rocks. So most of my patients are getting fat transfer to manage this condition, and that will help blend that rock into the shoreline again so that it doesn't look so obvious. And to me, that's a surgical condition. For people that are not ready to do a fat transfer or have other reasons that, in my opinion, may not be safe, for example, if someone's really, really young, maybe 20 years old, and there's some metabolism changes that occur over time, or if someone's grossly overweight, that I feel that their weight would fluctuate enough that the fat that I transplant may not be entirely safe. And those candidates, then Restylane or other types of injectable products, can be very safe if done by an experienced injector around the eye to manage it. I rarely cut the lower eyelid, so I just want to introduce that comment that I've given before, which is just be careful. Anytime you cut on the lower eyelid through a skin muscle flap, even the best surgeon can either distort the eyelid shape by being a little bit too high, a little bit out, a little bit down, a little bit in. Any of those changes can be negative, in my opinion. So that was a summary of reasons why we have lower eyelid dark circles, and maybe it's a good way for you to think about things and maybe present those ideas to the right physician or surgeon to help you.